Today's presentation, Dispensing by Registered Nurses Employed within Regional Health Authorities. In this presentation, we are going to provide information related to the scope of practice and expectations for registered nurses and nurse practitioners in Newfoundland and Labrador who practice with the approval and under the general supervision of a regional health authority in relation to dispensing. The authority for dispensing by registered nurses is found in Section 3, Subsection 2 of the Pharmacy Act 2012, which states that this act shall not extend to or interfere with the dispensing of necessary drugs or medicines by registered nurses in the course of duty when practicing with the approval and under the general supervision of a regional health authority. So there's some confusion regarding dispensing of medications by registered nurses who work within a regional health authority and those who do not. The quick answer to that is, unless you are employed with a regional health authority, you do not have the approval to dispense medications. So what is dispensing? There has been some confusion regarding exactly what dispensing is and what the roles and responsibilities are of RNs with relation to dispensing. So dispensing has been defined as a practice of pharmacy, and it means to provide a substance or item ordered by prescription, but it does not include the administration of that substance or item to a person or animal. So essentially, dispensing is a practice of pharmacy, and it means that you can provide a substance or item that has been ordered by a prescription, but you do not administer it at the time that you provide the substance. So essentially, you can provide the client with one dose of a medication, so they take it themselves or by somebody else at a later time. And you should not do this act frequently. It should be done only once. However, dispensing is not the same as supplying a client with their medications, either their prescription bottle or their blister pack, because those medications were already prepared specifically for that client by pharmacy. So it is okay for you to give a client his or her blister pack or prescription bottle. That's not the same as administering. That's just considered to be supplying the medication and not dispensing. It is also not dispensing to fill a medication aid or an alternative container with the client's own blister pack or prescription bottle, and you may do this to facilitate self-administration or the administration by another caregiver. It is also not dispensing to repackage or relabel drugs from a client's own supplies. It is also not dispensing to obtain medications from ward stock or a night cupboard that will be administered directly to the client by a registered nurse. Or some ward cupboards or night stocks have medications that are labeled for that specific client. So what standards govern dispensing? RNs practice in accordance with the College of Registered Nurses Newfoundland and Labrador Standards of Practice for Registered Nurses. In addition, in relation to dispensing, registered nurses must be knowledgeable and practice as per accepted standards governing dispensing that are found in the Newfoundland and Labrador Pharmacy Board Standards of Pharmacy Operation Community Pharmacy, that's June 2015, and the Newfoundland and Labrador Pharmacy Board Standards of Pharmacy Operation Hospital Pharmacy, which was updated in January 2018. In addition, employer policies and procedures and quality assurance mechanisms should be in place prior to dispensing practices. Policies, procedures, and quality assurance initiatives must be developed and should be in consultation with pharmacy services within the Regional Health Authority and in collaboration with nursing services. The Regional Health Authority should ensure that registered nurses have access to relevant and current reference material and access to a pharmacist or pharmacy service when consultation is required. Nurses are also expected to contribute to the ongoing development of policies, programs, and practices. RNs adhere to relevant employer policies for dispensing medications and identify any areas of concern and advocate for quality, safe dispensing practices and systems consistent with standards governing dispensing and legislation. So there has been a new piece of legislation. As of October 23, 2018, there have been new laws under the Food and Drug Regulations Act that affect all healthcare professionals who dispense Class A opioids. When you look at the Class A opioids table, if you are dispensing any of these medications, as a healthcare provider, you are required to apply a warning sticker to the prescription bottle, container, or package when used in dispensing, and you must also provide the client with a patient information handout. So this is different than if you were to give a medication to a client from the emergency department, like Tylenol. Usually you would just give it to the client and put it in a package and say that you take this in 4 hours until your pharmacy opens to get your new prescription. In this instance, if you are dispensing anything from the Class A opioid table, you do have to apply a warning sticker to the bottle and you have to go over the patient's information handout. So this picture here is just a picture of the Class A opioid table, and then there's a picture of the sticker that you have to go on Health Canada's website, and then you can download to adhere this warning sticker to the prescription bottle. And if you go to this website listed on the screen, you will also get your patient information handout on opioid medicines that you would give to your client and go over with them prior to them leaving your care. Although dispensing is mainly a practice of pharmacy, it can be a practice requirement with 4 RNs who, only with the approval and under the general supervision of a regional health authority, may need to dispense prescribed medications. So you can only dispense if you are working in a regional health authority. If you are not employed by a regional health authority who has given you the authorization and will supervise your dispensing, you cannot dispense. So this is for people who are self-employed or contracted or working for private business. If it's not within a regional health authority, RNs cannot dispense. So just a couple of reflections if you are asked to do it. So the first thing you need to reflect on is, do you have the written approval and authority from your regional health authority? Other things to consider is that your pharmacy department thinks that it's appropriate and necessary for another healthcare professional, such as a registered nurse, to dispense in particular situations. So this goes back to your regional health authority employer policy. It has to be made in consultation with pharmacy and nursing services. If your in-house pharmacy services are not available and you are allowed to dispense, then you can. If they are available, then why would you need to dispense? You wouldn't. There's no immediate access to a community pharmacy services, so they're not open, or there's an urgency to dispense the medication, and you must have the appropriate education, supervision, policies, and necessary computerized systems. So this is just some examples of when dispensing may occur in areas with limited or no access to pharmacy services, in emergency department situations where RNs on nursing units may need to dispense from the night cupboard or ward stock for an unexpected short leave from a healthcare facility. So the medication, in this case, the medication has not already been dispensed by the client's pharmacy or the hospital pharmacy. Or in specific or limited situations as approved and established by the RHA, such as where there's areas with limited or no access to pharmacy services, there might be medical directives, or it might be in a community setting for dispensing of oral contraceptives. So for another example would be in the emergency department, RNs may dispense a portion of a prescribed medication for a client when pharmacy services are not available at the time, or if there's an urgency to dispense a small portion of a prescribed medication, such as you initiated a course of antibiotic therapy and it needs to be administered every 6 hours, but your client will miss the 6-hour window if you don't give them the medication to take home with them because the pharmacy is not open at the time. Or another example would be if your client was diagnosed with a communicable disease and they needed to have a specific time-sensitive course of therapy and there's nothing open, and you have the policies in place, then you can give them their medication to take at a later time. There are some unique dispensing situations. It is the responsibility of the regional health authority to ensure policies and procedures are developed collaboratively with the pharmacy department to cover the partial filling of a prescription by a registered nurse, and also the preparation of drugs to cover a patient's leave of absence. So if they're leaving the hospital setting for a couple of hours. These policies should ensure dispensing remains the primary responsibility of pharmacy, because dispensing is an active pharmacy, and it should address all aspects of documentation and/or communication required between the dispensing RN and the pharmacy department. The RHA policy should also identify any areas where exceptions occur to the Newfoundland and Labrador Pharmacy Board standards of pharmacy operation in a hospital pharmacy setting. So, for example, the use of properly labeled envelopes to hold 24-hour portions of a prescription rather than the use of a child-resistant container as required. When a child-resistant container is not utilized, a notation to that effect should be documented in the client's record. So these are just a couple of unique situations: partial filling of prescription, or if the patient's having a leave of absence from the hospital for a specified number of hours. Sometimes, however, dispensing can be part of the routine scope of practice of a registered nurse, and this might be in areas where there are limited pharmacy services. So the Newfoundland and Labrador Pharmacy Board Standards of Pharmacy Operation in the Community Pharmacy stipulates the requirement for dispensing criteria and the employer policy programs to support these processes. Now, we already have a document, because this is quite a lengthy process, so we already have a document on our www.crnnl.ca website about dispensing by registered nurses employed within a regional health authority. And that will give you step-by-step instructions on dispensing when it becomes a routine scope of practice. And I'll just give you a couple of examples. Like it will tell you that before a prescription is dispensed, it is the RN's responsibility to review the patient's profile and patient medication profile and to take any appropriate action where applicable with respect to the appropriateness of drug therapy, drug interactions, allergies, intolerances, or adverse drug reactions, any kind of therapeutic duplication. You have to make sure you follow your medications management document as well to make sure it's the correct route, dosage, frequency, that's the right duration, administration, drug form. Additionally, it will outline any preparation prior to dispensing, ensuring that you make sure that the prescription is written and that's authentic and clear, that it's the intended patient, it's the correct drug dose route. The quantity of the medication to be dispensed needs to be noted, and as well as the frequency, interval, and maximum dose, and whether it can be refilled if there's a partial authorization for refill. Prescriptions may not be filled beyond 1 year from the date at which the prescription was originally written, so you need to consider that. And if the prescription is received verbally from the provider, then it must be recorded in an accessible and audible manner. And if the prescription is written for a narcotic or controlled drug or substance, then that is subject to the government Newfoundland and Labrador's tamper-resistant prescription drug pad program, then you, as the dispensing registered nurse, are responsible and accountable to ensure that all requirements of the program are met. So if you take anything from this presentation, it's just that you have to have written authorization from a regional health authority in order to dispense medications. And medications is not the same as administering. Dispensing is giving a drug that has not to be administered at that time, but the client is going to take it and self-administer or have somebody else administer to it at a later time.